It's a very important topic, B12 deficiency. B12 deficiency is becoming more and more common, and I want to talk about 7 signs that doctors sometimes miss. A B12 deficiency is not blatantly black and white. Sometimes it can be a very obtuse diagnosis, and I want to tell you about 7 signs.
A vitamin deficiency might sound harmless until you learn it can affect your brain, damage your nerves, and even mimic serious neurological diseases. Vitamin B12 deficiency is far more than just feeling tired. Here are the 10 dangers you need to know about. Pale skin.
Number one, pale skin. Now, why would you experience pale skin? Well, because you're not able to make red blood cells and you're not getting the oxygen. And so your body is starving of oxygen and you're looking a rather pale, like you would see in someone that's anemic. Now, sometimes your skin might be a little yellow or jaundice because the red blood cells are fragile and the byproducts can then create that appearance.
B12 is essential for producing healthy red blood cells, and without it, the body struggles to make enough functional cells to carry oxygen. As red blood cell numbers and hemoglobin levels fall, less oxygen reaches the tissues, causing the skin to appear pale and washed out. In more severe cases, some people may also develop a slight yellowish tint to their skin, or the whites of their eyes. This happens because many abnormal red blood cells are destroyed before they can function properly, releasing bilirubin, which is a yellow pigment produced during red blood cell breakdown. The combination of anemia and increased bilirubin can create the classic lemon yellow appearance, sometimes seen in severe B12 deficiency. Constant fatigue.
Number two, you're going to feel constant fatigue, weak. You're always going to be sleepy and drowsy no matter how much you try to get some sleep.
One of the most frustrating symptoms of vitamin B12 deficiency is the overwhelming fatigue that doesn't seem to improve. No matter how much you rest, this happens because anemia reduces the amount of oxygen reaching your body's tissues. When cells don't get enough oxygen, they are forced to produce energy less efficiently, leaving your muscles, heart, and other organs with less fuel to function properly. As a result, even simple daily activities can feel exhausting. The brain is especially sensitive to low oxygen levels because it requires a constant supply of oxygen and energy. Reduced oxygen delivery can lead to drowsiness, poor concentration, brain fog, and a general feeling of mental sluggishness. Many people describe it as feeling tired all the time, even after a full night's sleep. And that's the key difference. This isn't ordinary tiredness caused by a busy schedule or lack of sleep. The underlying problem is reduced oxygen delivery throughout the body. Sleeping may lower your energy demands temporarily, but it doesn't correct the anemia itself. That's why people with untreated B12 deficiency often say, "I slept all night, but I still woke up exhausted." Mouth problems. Many people develop painful mouth ulcers or a smooth, swollen, bright red tongue, a condition known as glossitis. This happens because the cells lining the mouth and tongue divide rapidly and rely on vitamin B12 for healthy growth and repair. When B12 is lacking, these tissues can't regenerate properly, leading to inflammation, soreness, and changes in appearance. Anemia may also reduce oxygen delivery to these tissues, which can worsen the discomfort and contribute to the tongue's swollen, shiny look. Cognitive issues.
Cognitive issues. So without B12, you can be very, very depressed, severely depressed. You can have anxiety. You can have memory problems. You can have paranoia. You can be delusional.
Vitamin B12 deficiency can have a profound effect on the brain and nervous system. which is why some people experience cognitive and psychological symptoms long before they realize they have a vitamin deficiency. B12 is essential for maintaining myelin, the protective coating that surrounds nerve fibers and helps electrical signals travel efficiently throughout the nervous system. It also plays a critical role in the production of neurotransmitters, the chemical messengers that regulate mood, memory, concentration, and behavior. When B12 levels become too low, several problems begin to develop. First, the body struggles to maintain healthy nerve cells and myelin, disrupting communication between different parts of the brain and nervous system. At the same time, levels of homocysteine and methylmalonic acid, MMA, rise, which can have toxic effects on nerve tissue. Research also suggests that B12 deficiency may increase inflammation and oxidative stress in the brain, further impairing normal neurological function. In addition, many people with severe B12 deficiency develop anemia, which reduces the amount of oxygen delivered to the brain. The brain consumes about 20% of the body's oxygen despite making up only a small fraction of its weight, so even modest reductions in oxygen supply can affect mental performance. As a result, people may experience brain fog, difficulty concentrating, slower thinking, forgetfulness, and problems with short-term memory. As the deficiency progresses, mood and behavior can also be affected. Some individuals develop depression, anxiety, irritability, or emotional instability. In more severe and prolonged cases, symptoms can become much more dramatic, including paranoia, hallucinations, delusions, or psychosis. Historically, some patients were even misdiagnosed with psychiatric disorders before doctors discovered that an underlying B12 deficiency was responsible. This is what makes vitamin B12 deficiency particularly important to recognize. The symptoms may appear psychological on the surface, but the root cause is biological. The brain and nervous system simply cannot function normally without adequate B12. The encouraging news is that many of these symptoms can improve significantly when the deficiency is identified and treated early, although long-standing neurological damage may not always be fully reversible. Nerve damage.
And this does relate to the cognitive function, but nerves, okay? If you're deficient in B12, you're not going to be able to make myelin. Myelin is the coating around the nerves, like I talked about. And so if you can't make this myelin, you're going to start getting a short-circuiting problem in the nervous system.
One of the most serious dangers of vitamin B12 deficiency is nerve damage. To understand why, think of your nerves like electrical wires. Just as wires need insulation to carry electrical signals properly, nerves rely on a protective coating called myelin. Vitamin B12 is essential for building and maintaining this myelin sheath. When B12 levels become too low, the body can't properly maintain the coating, and nerve signals begin to slow down or become disrupted, almost like a short circuit in an electrical system. This damage often first appears as peripheral neuropathy. Peripheral refers to the outer parts of the body, such as the feet, toes, hands, and fingertips, while neuropathy simply means nerve damage. Early symptoms may include tingling, numbness, burning sensations, pins and needles feelings, or unusual sensitivity to touch. For many people, these symptoms begin in the feet before gradually moving upward. As the deficiency progresses, the damage can become more severe. People may develop balance problems, muscle weakness, difficulty walking, or chronic nerve pain. This happens because the nerves responsible for sensation and movement are no longer transmitting signals correctly. In some cases, the spinal cord itself can be affected, leading to a condition known as subacute combined degeneration, which can significantly impair coordination and mobility. The most concerning part is that nerve damage caused by B12 deficiency is not always reversible. If the deficiency is recognized and treated early, the nerves often recover and symptoms improve. But if it goes untreated for months or years, permanent damage can occur. Some individuals are left with chronic pain, numbness, or mobility problems even after their B12 levels have been corrected. That's why doctors consider neurological symptoms of B12 deficiency a medical priority. The sooner the deficiency is identified and treated, the better the chances of preventing long-term or irreversible nerve injury. Blurred vision.
Blurred vision. Why? Because what helps you see is the retina.
Another lesser-known consequence of vitamin B12 deficiency is vision problems. Most people don't immediately associate blurry vision with a vitamin deficiency, but it makes sense when you remember that seeing is not just an eye function, it's also a neurological function. The retina, which captures light and sends visual information to the brain, is actually made of specialized nerve tissue. The optic nerve, which carries those signals to the brain, is also part of the nervous system. Because vitamin B12 is essential for maintaining healthy nerves and the protective myelin coating around them, a deficiency can affect the nerves involved in vision just as it affects nerves elsewhere in the body. Over time, damage to the optic nerve can interfere with the transmission of visual signals from the eye to the brain. As a result, people may notice blurry vision, difficulty focusing, reduced visual sharpness, or changes in color perception. One of the warning signs is a gradual decline in vision that doesn't seem to have an obvious explanation. Some people find themselves needing stronger glasses or struggling to see clearly, despite no major changes in their eye health. If your eyesight seems to be getting worse for no clear reason, especially if you're also dealing with fatigue, tingling or numbness in your hands and feet, memory problems, or balance issues, it may be worth considering vitamin B12 deficiency as a possible cause. The encouraging news is that if the deficiency is caught early, vision problems often improve with treatment. However, if optic nerve damage becomes severe and prolonged, some visual loss may become permanent, making early diagnosis especially important. False pulse rate.
Pulse rate. Now, why would the heart start increasing its beats?
Another common sign of vitamin B12 deficiency is a fast or racing heartbeat. This happens because B12 is essential for producing healthy red blood cells, which carry oxygen throughout the body. When B12 deficiency leads to anemia, there are fewer red blood cells available to deliver oxygen to the tissues. To compensate, the heart has to work harder and pump blood faster in an attempt to deliver enough oxygen where it's needed. As a result, people may notice a rapid pulse, heart palpitations, or a feeling that their heart is beating harder than usual, especially during physical activity. It's the body's way of trying to make up for the reduced oxygen-carrying capacity of the blood. Pregnancy complications and birth defects. Vitamin B12 is especially important during pregnancy because it plays a key role in the growth and development of the baby's brain and nervous system. When a mother doesn't have enough B12, the risks of complications can increase, including neural tube defects, premature birth, low birth weight, miscarriage, and developmental problems in the child. Research has shown that even mildly low B12 levels can be a concern, particularly when they lead to elevated homocysteine levels. The good news is that identifying and correcting a deficiency early through proper supplementation can significantly improve outcomes for both mother and baby. Subacute combined degeneration, SCD of the spinal cord. One of the most serious complications of severe vitamin B12 deficiency is a condition called subacute combined degeneration, or SCD, which affects the spinal cord. When the body doesn't have enough B12, the protective myelin coating around nerve fibers begins to break down. Over time, this can damage the parts of the spinal cord responsible for balance, coordination, and sensation. People often notice that they're becoming unsteady on their feet. Some describe it as feeling like they're walking on cotton, or having trouble knowing exactly where their feet are when they walk. Others experience frequent stumbling, muscle weakness, stiffness, or a loss of vibration and position sense. In advanced cases, MRI scans can reveal characteristic changes in the spinal cord that help doctors make the diagnosis. The good news is that if B12 deficiency is caught early, B12 injections can stop the damage and often lead to significant improvement. However, if treatment is delayed for too long, some of the nerve damage can become permanent. That's why neurologists consider B12 deficiency a condition that should be identified and treated as early as possible. Peripheral neuropathy, nerve damage in hands and feet. One of the earliest and most common signs of vitamin B12 deficiency is tingling or numbness in the hands and feet. This happens because B12 is essential for maintaining the myelin sheath, the protective coating that surrounds nerves and helps them transmit signals efficiently. When B12 levels become too low, this coating begins to break down, causing nerves to misfire and produce sensations often described as pins and needles. At first, the symptoms may be mild and occasional, but over time they can become more frequent and spread to larger areas of the body. Some people develop burning pain, reduced sensation, or difficulty feeling temperature and touch. Research shows that tingling and numbness are among the most common neurological symptoms of B12 deficiency. The encouraging news is that early treatment can often stop the damage and allow nerves to recover. However, if the deficiency goes untreated for too long, some nerve damage may become permanent. B12 deficiency is common, treatable, yet dangerously underdiagnosed. These 10 dangers are backed by extensive research. Don't wait for severe symptoms. Get tested if you have fatigue, tingling, brain fog, or risk factors. Share this with family and friends. It could prevent real suffering. Thanks for watching.